My name is Emily Billingsley and I work with Healthy Kids Clinic, which is part of Cumberland Family Medical. Today Miss Leslie Hall has asked me to come in and talk to you all about first aid and CPR. So first we'll cover all of the stuff about first aid and then we'll do CPR. So an emergency is defined as a serious, unexpected, often dangerous situation that requires immediate attention. And there's a couple things you can do in an emergency, which is the first aid and CPR. Before you can provide assistance to anyone, what's the first thing you should do? Before going in, and even before you ask them, can I help you? What do you need to do? Okay, even before you call 911. You need to check the scene, because if the scene's not safe and you go in, the scene's not safe, then there's going to be more than one victim. Okay, so if there is a building burning, if there's gunfire, if there's an electric line over a car or something, you just call 911 because you can't go in there and help them. There are several different types, so we'll first start talking about bleeding. Bleeding is when a person's skin is broken, and if the skin's broken open, then they have what's called an open wound. If a person has an open wound, has severe bleeding, then you need to apply pressure to it. So if you have a first aid kit at the school, or if you're on a field trip, teachers have stuff with them, apply a bandage over it. And if it bleeds through that bandage, just reinforce it. Don't take the bandage off to put another one on. Just keep reinforcing that one. If you can't get the bleeding to stop, then what should you do? Who should you call? Call 911, okay? And then also, as far as a tourniquet, you can use a tourniquet. Where do you put the tourniquet on the, so if there's an open wound right here, where are you going to put the tourniquet? Below it or above it? Above it, okay, constrict that blood flow to the area. You need to lean forward if you have a nosebleed. Pinch the nose and lean forward. The reason being, if you lean back, that blood is going to drain down your throat and into your stomach and probably cause the person to vomit by, swallowing all that blood. So pinch the nostrils till it stops. If it's severe, you can't get to stop after about 10 minutes, then you need to seek emergency help. Call 911, get them to their doctor. There's different types of burns. There's thermal, chemical, electrical burns. With a thermal burn, just remove them from the source of heat. If they're touching something hot, make sure that source of heat's gone. For a chemical burn, remove the clothing that's contaminated with the chemical. If it's liquid, flush the area for 20 minutes or until EMS arrives. If it's a powder, put on some gloves and brush that powder off, then flush it with water. You don't want to touch the powder with your hand, because then what's going to happen? You're both going to have a chemical burn. So use a glove, wipe it off, and then flush it till EMS gets there. If it's an electrical burn, you need to make sure the power is turned off at the source. Never approach the victim or the person until you're sure the power's been turned off. And then try to cool the burn down until EMS gets there. Strokes occur when blood flow to part of the brain is interrupted and causes brain cells to die. So people that's had a stroke will have trouble talking, weakness, drooling. They'll have trouble swallowing. They may have drooping of the face or one of their arms. If you see someone that you ever think are having stroke symptoms, then you need to call 911 immediately, because with a stroke, the faster you can get those people help, the better their chance of survival is. So they have an acronym called FAST. So if they have facial drooping, arm weakness, speech difficulty, then it's time to call 911. So anytime you see someone you think's having a stroke, always act fast. Seizures are caused from abnormal activity in the brain, which causes temporary and involuntary changes in body movement, function, sensation, awareness, and behavior. There's many different types. What people normally think of when they think of a seizure is the grand mal seizure, and that's where they're jerking all their extremities. They may have loss of consciousness. Another type of seizure is just an absence seizure, where people just kind of stare off into just for a few minutes, and then they kind of like come back to reality. If you see someone having a seizure, do you need to like hold them down and try to stop it? No. So if there was somebody sitting in this chair that started having a seizure and fell into the floor, then you just need to move the table and step away from them. Make sure they're in a safe area and just leave them there, let the seizure run its course. When the seizure is over, make sure they're responsive. And if they don't have a history of seizures, or if they just keep having seizures back to back, or if they were injured, then you need to call 911. If you're not sure, if you're out somewhere and you don't know if the person's ever had seizures, you don't know any of their history, then it never hurts to call 911 just to get them checked out. Fainting or passing out is just a loss of consciousness caused by sudden decrease in blood flow to the brain. So what you need to do is make sure they're not injured. So if a person just falls to the floor, passed out, usually within a minute or so, they come back around. So always check for their responsiveness and make sure they're not injured. Call 911 if needed, if they don't start responding as fast as you think they should. And if they do come back quickly and start acting normally, you still need to encourage them to follow up with their family doctor. Diabetes is a condition that makes it hard for your body to process glucose. So sometimes if sugars get too high or sugars get too low, then it becomes a diabetic emergency. More so when the sugar gets low, they'll start getting dizzy, shaky, headaches, moist skin. They'll start acting confused, and sometimes people will even have seizures. If they are known to be a diabetic and they start experiencing these symptoms and they are alert and can talk to you, then you can give them some form of sugar. So give them some fruit, milk, or fruit juice rather, milk, a regular soda, or some sugar mixed in water. But if that person's not responding, then you do not need to try to make them drink or eat anything. A lot of times people that have diabetes will pack what's called glucagon with them. And if you know they have that, then you can get them help using that. It's just a shot that has sugar. Asthma is a chronic disease involving the airways that carry air in and out of the lungs. When someone has asthma, those airways are always inflamed. So that inflammation, it makes their airways sensitive, and the tubes react to allergens or irritants. So a lot of times people that have asthma during the springtime, when everything starts blooming, they'll start having lots of flare-ups. So if somebody's having difficulty breathing, you know they have asthma, but they have their inhaler down the hall. Do you need to send them down the hall to get their inhaler? No, you need to help them. You need to let them stay there, and then you go get their inhaler for them and bring it back. Okay. And if you're not, if you're ever not sure what to do, you're out somewhere, you see somebody having trouble breathing, always just call 911. Anaphylaxis is when people have a reaction to some kind of allergic response. So it could be peanuts, it could be bees, it could be eggs. So people that have allergic reactions, a lot of times they'll start having swelling of their throat and their tongue. They may have hives, and sometimes they may go into shock. So if you think someone is experiencing anaphylaxis, then always call 911. If somebody's known to have an allergy, they'll probably have an EpiPen with them. So you can help them or encourage them to use their EpiPen or help them use it. And if they were to become unresponsive, then you can start CPR. Heart attacks occur when blood flow to part of the heart is blocked. It results in cells in the muscle not receiving oxygen and nutrients they need, which can lead to permanent damage. Most of the time, someone that's having a heart attack, the universal sign is what? They'll clutch their chest, okay? So they'll have chest pain, but not all people that experience heart attacks have chest pain. Some will have neck, arm, back, shoulder pain. Some people will just get sick at their stomach, nauseated. Some people will be clammy. Some people will just be really tired, or they'll have trouble breathing. So just help that person to a comfortable position and call 911. If they become unresponsive, then you'll have to start CPR. All right, so now we're going to talk about choking. We'll start with an infant, and then we'll do an adult. So If you think an infant is choked, but they're crying or coughing forcefully, then just let them keep coughing, okay? But if they have a weak cough or they can't cry, then that's when you need to start the measures to help them. So at that point, you need to go on and call 911 and have someone to get the AED if you're at an area where there is an AED. So with the infant, I'll explain it to you and then I'll show you. So you're going to put your arm along the infant's back and just kind of hold the infant along your arm. And then with your other arm, you're going to, with your other hand, you're going to do back blows on the infant. So we have the infant, and always hold them head down. Let gravity help you, okay? You're going to do 5 back blows. So you're going to go 1, 2, 3, 4, 5. Then you're going to flip them over and do what's called chest thrust. 1, 2, 3, 4, 5. And you're going to keep doing that until the object comes out or that baby becomes unresponsive. Okay, but always hold them down. That way, because if you hold it up like this, then what's going to happen? Yeah, it's going to go back down farther. So with an adult or a child, what's the universal sign for choking? People will be clutching their throat, okay? So you always verify that they're choking. Say, are you choking? And then have someone that's nearby to call 911 and get the AED if there's one around. Always tell the person your name and ask if you can help them, okay? You have to ask first if you can help. Most people are going to say yes, you know, but if they say no, then just call 911 and wait till the ambulance gets there. But if they agree to help, then you'll do the same with an adult as you do with a child as far as the back blows and the chest thrust. So you're going to put yourself kind of to the side of the adult and have them bend forward at the waist. And you're going to, with the back of your hand, do the 5 back blows, just like you would do with an infant. Then raise them up. If they're still choking, at that point you need to do the Heimlich, okay? So you'll get behind them, locate their navel or their belly button, right above it, place a fist, place your hand over it, and you're going to go in and up. You're going to do that 5 times. And then you'll repeat until, when do you stop? Till the object comes out, or if they become unresponsive and you have to start CPR. All right, so we're going to practice these. And another thing, if the person is too large for you to get your arms around them or they're pregnant, then you can do just chest thrust, just at the middle of the chest, and just go back up higher where you can get your arms. Go right under their arms, up here where you can get your arms, and do 5 chest thrusts. So if you think somebody's unresponsive, what's the first thing you need to do? Yeah. Shout to get their attention. If you know their name, yell their name. If no response and it's an adult, you can tap them on the shoulder, or a child. If it's an infant, then you tap the bottom of their foot, okay? And then shout again their name. While you're doing that, you need to be checking for their breathing. You need to look for their chest to rise and fall. You need to listen to hear if you hear like gasping breaths, and then you need to be feeling. So you'll kind of hold your hand like either over their mouth, nose area, not covering it, but just right above it to see if you feel any air coming out. And you should check for the responsives. Should not take any longer than 10 seconds. So you go in, you find somebody laying in the floor or slouched over in a chair, and within 10 seconds you should yell their name and check to see if they're breathing. If someone is unresponsive, that's when we need to start CPR. CPR is cardiopulmonary resuscitation. It's an emergency procedure that can help save someone's life if their heart stops or if their breathing stops. And when a person's heart stops beating, they're in what's called cardiac arrest. And during cardiac arrest, the heart can't pump blood to the rest of the body, including the brain and lungs. So death can happen in minutes without treatment. CPR uses chest compressions, which mimics the heart pump. These compressions will help keep the blood flowing through the body. So when you go to give chest compressions, you're going to do about 100 to 120 chest compressions per minute. A minute, yeah. So you'll do 30 compressions and then 2 breaths. But you're going to do around, if songs that have about 100 beats per minute is the song Staying Alive. Y'all heard that song? It's an old song. Yeah, Staying Alive. So that's about 100 beats per minute. So when you go to do your chest compressions, if you can just think of that song, then it'll give you the right tempo that you need. So we'll start with doing CPR on an infant. So you need to verify that the infant is unresponsive and not breathing. How do we do that? Okay, shout and then tap them on the bottom of the foot. And what else do you need to be doing while you're checking their responsiveness besides just shouting and tapping the bottom of their foot? Check for their breathing. And how long do you have to do that? 10 seconds. So you have to place the infant on a firm, flat surface. And then stand, or if it's on the floor, you're going to have to kneel down beside them. If that infant is in a crib or a bassinet or something, whenever you find them, then they have to be taken out of that and put on the floor or a hard table. You cannot give effective compressions if they're in a crib, because what's going to happen? Every time you go to give a compression, it's just going to sink down, okay? So you're going to give 30 compressions. You're going to place one hand on the infant's forehead and then the pads of 2 fingers in the center of the chest on their breastbone, just below the nipple line. So you're going to, about right here. When they're laying there, you're going to have one hand on their forehead, and then you're going to take your 2 fingers right at below the nipple line, and you're going to compress about 1.5 inches. On these mannequins, when you get 1.5 inches, you're going to hear the spring. Okay, so that's how you're going to know you're 1.5 inches. You're going to give compressions at what rate? 100 to 120 per minute. So you're going to go 1 and 2 and 3 and 4 and 5 and 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 29, 30. And then you're going to tilt their head back and give them 2 breaths over 1 second each. And while you're giving the breaths, you're going to watch for their chest to rise. If their chest doesn't rise, re-tilt the head and try the breath again. If it still doesn't rise, then go right back into your compressions. Whenever you do CPR, we have barrier devices, and you're going to cover the infant's nose and mouth with the device. If you have one available. So you'll cover the nose, the mouth, and give your 2 breaths. Okay? With an infant, also, if you come upon a child that's unresponsive or an infant and you shout for help and there's nobody there, then you need to give 5 rounds of 30 compressions and 2 breaths, and then leave and go call for help. You'll hear a difference when we talk about the adult in a minute. So if I come upon this baby, I'm the only one there, I don't have a cell phone with me, there's nobody to help me, I give this baby 5 rounds of 30 compressions and 2 breaths, and then I leave and go call for help. So don't really give them breaths because I don't have barrier devices for everybody. Always count out loud too.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26,
would you do?
Breathe. Give it 2 breaths.
Okay, so the important thing to remember with infant and child CPR is if you're by yourself and you do not have a phone, how many sets of compressions and breaths are you going to do before you leave to go call 911? 5. 5 sets of 30 compressions and 2 breaths. Then you'll leave and go call 911. Always count out loud also whenever if you are in a place where you're having to do CPR, because if someone comes up and they know CPR, then they know where you're at. You're going to find when you do the adult one that you get really tired doing compressions, okay? So if somebody comes up and they know CPR, then you all can switch out and give you a break. So make sure on infant you compress about 1.5 inches and let the chest come all the way back up, which is called the chest recoil, in between compressions, okay? So with the adult, you start off the same way. You verify that they're unresponsive and not breathing. You shout to get their attention, tap them on the shoulder, all while checking for breathing. How long do you have to check for breathing and responsiveness? All within 10 seconds, okay? If the person is in a chair slumped over, can you do CPR in a chair? No, you have to, it's just like with the child. They have to be on a firm, flat surface, so more than likely you're going to have to lower them to the floor, okay? On their back, on the floor. You're going to give 30 compressions, so you're going to use the heel of one hand on the center of their chest at the lower end of the breastbone, and then you're going to take your other hand and put over top of it. And on an adult, you're going to compress about 2 inches. So it's a little deeper than with the child. Still at the same rate of 100 to 120 a minute and 30 compressions to 2 breaths. With the barrier device, you're going to place it over their mouth. But with an adult, you're going to have to pinch their nose. So like on the child, you put your mouth over nose and mouth. With an adult, you pinch the nose and then just put your mouth over theirs. These barrier devices have what's called a one-way valve. So your air is going to go in, but nothing from them can come back through. Like, you're not going to get any air from them back through there, okay? So you do your 30 compressions, 2 breaths, and you keep doing that until when? When would you stop giving CPR? If they start breathing again, regain consciousness. They're already unresponsive, or until EMS gets there. So when you find an adult that's unresponsive, if there's someone around, have them to call 911. If you have your cell phone with you, call 911 and put them on speakerphone. Say, I've come upon so-and-so if you know their name. If not, just say a male or female, unresponsive. They're going to walk you through the steps of CPR over the phone. Even if you know it, they're still going to give you a refresher real quick over the phone. And in the meantime, they're going to have EMS on the way. With an adult, you leave. If no one's around, you don't have a cell phone, you leave and go call 911 and then come back. So that's the big difference with the child. With the infant and child, you do 5 rounds first, then leave and go call. With an adult, you leave first and go call. So with an adult, you're going to take the heel of one hand at the lower half of the breastbone, but try to avoid this little bony prominence right here. On these, you can see it really easy. That's your xiphoid process. If you push on it, you're just going to break it. So right above it, so just right below the nipple line. Then you're going to put the heel of your hand, you're going to place your other hand on top, and you're going to have to compress down. It's 2 inches with an adult, okay? The adult mannequins are the same as the child. You'll hear the spring. When you go to practice these, you're going to have to probably get in the floor because you need your arms to stay straight. You can't bend your elbows, okay? I usually get the question of, what if I break somebody's ribs? Because sometimes it happens. When you're giving CPR, you break people's ribs. Kentucky has the Good Samaritan law that you'll be covered under. As long as you, in good faith, do what you know to do, and something happens or there's not a good end result, you're covered under that Good Samaritan law. Okay? So as long as you do what you think's right.
Alright, I think they still know the way. Okay. Hello, 911. Yeah, this person will not That's at 100.
One more thing to talk about real quick before class is over, and that's the AED. Whenever you call for help, then you always have someone to get the AED. When you're doing CPR, you need to have the patient's bare chest showing, okay? So when you go to use the AED, you're gonna put this on a bare chest. So an AED is just an automated external defibrillator. So it's just a portable device that can automatically diagnose life-threatening rhythms. There's just a couple rhythms that have to be shocked, but this thing's going to tell you, okay? You're going to put this on them. It's going to walk you through step by step what to do, and if that person needs to be shocked, it's going to tell you to shock them. So you'll just get your AED. It's going to have a package of pads. It should have adult pads and child pads. Some of them may only have the adult pads. So you're going to rip open the package, and once you open the package, it's going to show you exactly where to place the AED. So one is going to go on the right upper shoulder, and the other is going to go to the left. Okay? And even, this is just the trainer AED, but any AED that you have, it's going to show you where to put the pads at, okay? Then you're going to make sure everybody is clear from the patient so that the machine can analyze the rhythm. So it'll say, analyzing rhythm, stay clear. And at that point, make sure everybody's clear. Then it's going to say, shock advised, if they need a shock. So at that point, you will push the red button, which will deliver the shock. And immediately after that, whenever it says it's okay to touch the patient, then you'll resume your chest compressions again. While you're doing chest compressions and somebody brings the AED and they're getting it hooked up on the patient, minimize the interruptions in your compressions. So somebody can still do compressions while one person's putting pads on. Okay? So you don't want any interruptions. Now, if the patient has been in water, you can still use an AED on them. You just want to get them out of the water, dry their chest off, and then put the pads on there. If the person has body jewelry, you can still use the AED. Don't take the time to take the jewelry out. Just make sure the pad's not on top of the jewelry. If it's a male that has a lot of chest hair, some of the AEDs will have little disposable razors. So if you can quickly shave them, then put the pads on. Or if there's two sets of pads, put them on, rip them off, and put another set on. When you turn it on, it analyzes the rhythm. What do you need to make sure everybody's doing? Staying back. And when it goes to give the shock, make sure everybody's staying back, okay? And then minimize the interruptions. It has to be put on a bare chest. Okay, it cannot go over clothing. Whether it's male or female, it has to be a bare chest. Okay? If the person has a internal pacemaker or defibrillator, you can still use this on them. Just don't put it over that. A lot of times you'll see a little pouch raised up, and so you'll know where to not put it at. And with a baby or a child that's too small, if you don't have child pads and you just have the adult pads, you can place one on the front and one on the back.